So, you're pregnant. Does that mean that you should immediately stop your psychiatric medications? Dr. Dona here, youth and adult psychiatrist, here to discuss all things mental health and wellness related. I'm here to discuss today what you should do when you find out that you're pregnant but are currently taking psychiatric medicines. So the short answer to that is no, you should not immediately stop taking all your medications once you find that you're pregnant. The longer answer is a little bit more complex or complicated. Once you find out that you are pregnant, it can come with a lot of emotions and a lot of things that you might need to navigate in terms of planning and preparation for pregnancy and the baby. But in regards to your psychiatric medication, careful consideration should be taken into account when it comes to what you should do with the psychiatric medication. And it's important that you touch base with your psychiatrist or doctor to know the next steps of what you should do in terms of your psychiatric medication. Please remember that I am a psychiatrist and a medical doctor, but I'm not your doctor. For any concerns related to you specifically, I would touch base with your doctor. So in terms of psychiatric medication in general, I would say that these are things to be taken into consideration just because there are issues that if you stop taking medication abruptly. So if you abruptly stop taking some of your psychiatric medications, it can lead to a recurrence or worsening of your current symptoms, whether it is depression or anxiety, which can be both harmful to the mother and the baby. And conditions like depression, anxiety, bipolar disorder, or other mood disorders can pose risks if untreated, including poor prenatal care, poor nutrition, and increased risk of postpartum depression and anxiety. So when it comes to the risk of stopping your psychiatric medications abruptly and the side effects that can happen, I would say this is something where you need to be in touch with your doctor specifically, and also it is dependent on the class of medications that you're using. Some of the SSRIs, which are used for depression and anxiety pretty often, while they're not life-threatening, can come with risks such as withdrawal symptoms or feelings recurring when you are stopping these medications. So that's when you would take it into consideration if you're stopping these medications abruptly. Usually, most women would benefit if they are taking an SSRI to continue it just because it meant that it was helping maintain mood and stability prior to pregnancy and during. For risks of continuing medication, some psychiatric medications may carry risks for the developing baby, such as potential birth defects or withdrawal symptoms after birth. However, not all medications have the same level of risk. These specific risks depend on the type of medication, the dosage, and the timing and exposure during pregnancy. Remember, a lot of times women find out that they're pregnant a few weeks into the actual pregnancy, and the most important time is during the 6 to 8 week period where teratogenesis is most likely to occur, and that it would be exposure to certain medications that can be debilitating to women. So these would be things to take into consideration. Alternative options. Your doctor or psychiatrist may consider adjusting the dose or switching to a safer alternative or implementing non-medication therapies like psychotherapy or cognitive behavioral therapy in place of medications. If you continue your medications, regular monitoring by your healthcare provider is essential to ensure both your health and the baby's health. If you stop medication, close monitoring for signs of relapse or worsening symptoms is also crucial.